Just today, reports surfaced the White House is considering offering tens of billions of dollars in cuts to Medicaid and Medicare, the lifeblood of many hospitals. The latest offer in some high stakes and very fragile debt negotiations. If you haven't seen this ad on TV yet, get ready for it.
Cutting Medicare and Medicaid payments to hospitals could overload emergency rooms.
The nation's hospitals are starting a PR blitz to convince you that it can't weather another series of government budget cuts. We're told industry leaders have ordered hundreds of hospital managers nationwide to Washington next Wednesday to lobby Congress against further cuts to Medicaid and Medicare. The industry's top lobbyist told us hospitals would face layoffs.
And you don't want to go there if at all possible. You want to deal with administrative systems. But at some point, the cuts are going to get real enough that we're going to have to look at staffing or even programs.
Including cuts to expensive but less frequently used programs like neonatal intensive care and burn units. A New York Times report today says the White House is considering backing these big medical budget cuts to kickstart stalled negotiations over raising the nation's debt ceiling.
We wish we could keep all the promises that we've made. We don't have the money to do it, and I think it's a very unfortunate situation to be in.
So over the coming days, patients, doctors, and nurses like Christy Chapman tell us they'll be watching negotiations closely.
We still have to make sure that our patients get what they need, and a lot of nurses are just learning to be a little more innovative now because the pressure is becoming really high.
U.S. Treasury officials say to avoid financial catastrophe, these negotiations must end and the debt ceiling must be raised by August 2nd. In Washington, Scott McFarland for Statesman.com.